Let's quickly learn everything about eclampsia and pre-eclampsia. If they mention these two important keywords in the scenario, you should be confident that they are talking about pre-eclampsia, very high BP and proteinuria. Other points to keep in mind that they might mention in scenario are headache, decreased urine output, blurring of the vision, either nausea, vomiting, or just epigastric pain, facial edema or periorbital edema. Additionally, if they mention fits, then this pre-eclampsia scenario becomes eclampsia scenario. What is pre-eclampsia? It is a potentially life-threatening hypertensive disorder of pregnancy, which is characterized by vessel deformity as it involves vessels and systemic involvement that includes three major systems: brain, kidneys, and liver. Preeclampsia becomes eclampsia if there are fits or coma with high BP and proteinuria. Most common cause of death in this condition is cerebral hemorrhage. A major complication associated with preeclampsia or eclampsia is HELLP syndrome. H for hemolysis, EL for elevated liver enzymes, and LP is for low platelets. The cause of death if this complication does occur is stroke. Let's get to know who's at the risk of developing this condition. Those with uncontrolled high BP, primigravidas, obesity, and history of diabetes are also important factors. Investigations include blood investigations, that is complete blood count, CBC, all baselines, majorly LFTs, to rule out the HELLP syndrome. Clotting or coagulation profile, ultrasound as you might need to plan a preterm delivery, and CTG to check fetal heart rate. Management includes calling for senior help, ABC, that is airway, breathing, and circulation if patient is unconscious due to fits. Pass the IV line, and most important one to remember is MgSO4. It is a first line anticonvulsant. To manage the BP, give oral or IV labetalol or IV hydrolazine. If labetalol does not work, insert Foley's and maintain input and output charts. If patient has developed HELLP syndrome and platelets are low, consult a hematologist and act accordingly. Iatrogenic premature delivery of the fetus is often required in severe condition, so give the steroids before C-section if gestational age is less than 34 weeks. And give prophylactic heparin to prevent the thromboembolism. In these scenarios, look for the words such as high BP, proteinuria, headache, or epigastric pain. And if there are fits, then answer it as eclampsia instead of pre-eclampsia.